Understanding Gaucher disease, the different types, symptoms, diagnoses, and managements. Gaucher disease is a genetic disorder where fat-laden Gaucher cells build up in areas like the spleen, liver, and bone marrow.
This can disrupt normal organ function and cause various health problems. Symptoms can vary between those diagnosed with Gaucher disease. The most common symptoms include a swollen belly. This is due to liver and spleen enlargement. Bone problems cause bones to be brittle and break easily. Sometimes the bones don't get enough blood, which can cause pain. As well as blood issues, people may feel extremely tired because of the low red blood cells. Anemia. They might also bruise easily and get nosebleeds due to low platelets. In rare cases, neurological symptoms may appear, causing trouble moving the eyes, stiff muscles, problems swallowing, and seizures.
There are 3 known types of Gaucher disease. Type 1 is the most common type in the U.S. About 90 to 95% of people are diagnosed with type 1 between the ages of 10 and 20. Gaucher disease type 1 mostly affects the spleen, liver, blood, and bones, but it does not affect the brain. Not everyone will have symptoms. Those with type 1 are at a higher risk for Parkinson's. Type 1 is treatable but is not curable. Type 2 is a rare form and appears in infants younger than 6 months old and causes an enlarged spleen, poor movement, difficulty swallowing, and severe brain damage. There is no treatment for type 2, and infants with this condition usually pass away within 2 to 3 years. Type 3 is the most common worldwide but is rare in the U.S., and it appears before 10 years of age, most commonly diagnosed with a blood test for enzyme levels or a DNA test. Type 3 causes bone and organ abnormalities and neurological problems, including behavior changes. A curved spine can be common in type 3 and requires surgery. There are treatments available for those living with type 3 Gaucher disease that allow them to live into their 20s and 30s. Gaucher disease is caused by a deficiency of the lysosomal enzyme glucocerebrosidase, also known as GCase. This is an enzyme that breaks down fats in the body. When GCase is deficient, glucosylceramide builds up in macrophages, which are the immune cells, and results in fatty substances building up in certain parts of the body, most commonly in the spleen and liver. This is what makes the organs enlarge and affects how they work. The fatty substances can also pile up in the bones, making them weaker and more likely to break. If it affects the bone marrow, where blood cells are made, it can cause problems with blood clotting, making it harder for the body to stop bleeding. Gaucher disease is a rare autosomal recessive genetic disorder requiring both parents to be carriers for a child to be affected. Mutations in the GBA1 gene impair the breakdown of GCase, ultimately causing progressive organ dysfunction. Ethnic background has a huge influence on the likelihood of Gaucher disease. Individuals of Ashkenazi Jewish ancestry are at a higher risk of carrying the GBA1 mutation. A family history of the disease further elevates the chances of diagnosis, highlighting the importance of genetic awareness.
Early diagnosis of Gaucher disease is critical. Genetic testing, enzyme tests, and imaging help detect the disease, aiding in better treatment and management. Together, these tests help us understand the disease better. Genetic testing identifies GBA1 gene mutations. Identifying the mutations help identify the disease. DNA provided with your saliva or blood testing will give you a more definitive diagnosis of the condition. These tests can allow for early interventions and personalized treatment plans tailored to each patient's needs and symptoms. The enzyme activity test measures GCase levels in the blood or tissue samples. Low GCase levels indicate Gaucher disease, helping diagnose and assess the condition's severity. Imaging techniques such as MRI and X-ray allow to visualize changes in the organs associated with Gaucher disease. These tests will reveal the enlargement of the liver and spleen and assess bone status, providing valuable information for monitoring the disease progression. There's no cure for Gaucher disease. A variety of treatments can help control symptoms, prevent irreversible damage, and improve quality of life.
Enzyme replacement therapy, also known as ERT, is the primary treatment for type 1 Gaucher disease. ERT balances low levels of the GCase enzyme to help their bodies break down glucocerebrosidase. ERT involves receiving intravenous infusions approximately every 2 weeks. By supplying the body with the missing enzyme, they can reduce the symptoms of Gaucher's disease. Substrate reduction therapy, SRT, is an oral medication that decreases the amount of glucocerebrosidase that the body produces, reducing excess buildup. Substrate reduction therapy, or also known as SRT, is an oral medication that decreases the amount of glucocerebrosidase that the body produces, reducing excess buildup. SRT involves medications like miglustat and iliglustat, which reduces glucocerebrosidase production. thus managing Gaucher disease symptoms. SRT offers an alternative treatment for patients who may not tolerate ERT.
Managing Gaucher disease may require a tailored approach focusing on specific symptoms. This may include a splenectomy to help with spleen issues, bone care including supplements and surgery, blood transfusions to treat anemia, as well as other treatments to manage other symptoms. Emotional support is also very important. Those living with Gaucher disease will need lifelong treatment to manage the disease. With proper treatment, individuals with Gaucher disease type 1 can live their full lives. It is essential to work with a specialist and continue long-term treatments to prevent permanent damage. Without treatment, Gaucher disease can cause irreversible harm. Adults with the disease may face challenges in coping with the diagnosis, especially with the impact the pain has on their work, career, and recreational activities. Psychological distress, including mood changes and anxiety, is common. And many adults may also struggle with insurance concerns due to the high cost of treatment. Overall, consistent management and support are key to improving the quality of life for those with Gaucher disease.